about an hour and a half, and so we hope that you can remain on for the whole agenda. We are recording the meeting and we'll post it on our website shortly after it's finished, so you can also, if you have to step off at some point, go back and watch it later. Just wanted to say that we do have about 330 something people logged on, who signed on for the call. And so we are working with Zoom technology, which we're actually getting pretty good at, but just be patient in case if there's internet glitches or whatever. A couple of things you should know about the Zoom functionality is that there is a chat feature which you can open, and resources and other information will be posted in the chat feature as we go along. If you have a question, you can use the Q&A feature to put your question there. Please try to keep it general, you know, so that it is something not just specific to your organization. We will take a pause for questions, and that in the middle of the meeting and then later at the end. So again, patience with the Zoom technology. I just want to say, you know, for those of you who don't know Nonprofit Montgomery, we are an alliance of nonprofits that serve Montgomery County, and we do capacity building, strengthen the sector, and advocacy on behalf of the sector. And we are rolling out some new programs to help us deal with the current reality. So please do sign up for our news, become a member, check our website, and keep up with the programming that we're trying to bring you to stay relevant in these odd times that we're experiencing. Let's see. So let me just give you an overview of the agenda. First up is Councilmember Andrew Friedson to talk about the public health emergency grant legislation. Then we'll take a Q&A. Following that will be Councilmember Albornoz to talk about some other support that's forthcoming for nonprofits and individuals. Dr. Crowel, Director of DHHS, will be coming on to just give us a 40,000-foot view from DHHS, and Vickie Buckland will also be on from DHHS to answer some of the questions. And there was probably 100 questions sent in advance. We did forward those to the panelists, so they'll be trying to reflect the answers to those questions as we go through the agenda. Next up, we will have from the county executives side, Caroline Sturgis and BB Otero. And then we'll conclude with an update on the safety net clinics from our friends at the Primary Care Coalition, Lesley, Graham, and Barbara Eldridge. So without further ado, I'd like to introduce Councilmember Friedson and welcome you to the call. Thank you for being here today. Yesterday, if you've been all paying attention, there was some really historic action taken by the council to support our community, our nonprofits, and our businesses during this time. And I know Councilmember Friedson, you were a real architect of that legislation. So we really are appreciative for the council's efforts and the county executive's efforts, and would like to hear right from you more about it. Thanks for joining.
First of all, Lesley, thank you so much for having me, and thank you for doing these. Most importantly, it's obvious the amount of need that there is to get information out to those who are providing services on the front lines of our community, and you're really playing a pivotal role in that. And so I'm very grateful, and the council and the county more broadly is grateful for you being such a terrific convener, and this organization being such an important part of bringing everybody together, because that's what this is going to take. And we recognize that this has to be a partnership with our nonprofit partners, the government, not just at the county level, but at the state and federal level, all the different agencies working together. And to get on the same sheet of music is not always easy for us, and I'm not sure we always do it as well as we all would like, our best intentions aside. And so calls like this and repeated communication and mechanisms like this are really super helpful. I am really proud of what the council was able to do yesterday. What I said yesterday was, you know, times of crisis are moments of character, and I really felt like the council really stepped up to embody what the character of our community is that we are going to step up to help people who need it. And that means employers, nonprofit and for-profit, who are struggling to be able to stay running and in business. It means those who are most vulnerable in our community, who we want to make sure don't slip through the cracks. It means our frontline healthcare workers and first responders, who are the real heroes in the public health emergency that we are currently faced with. And in a number of different efforts in a number of different ways, with lots of work that went in from all of my colleagues, and working very closely with the executive branch and with other outside partners and agencies and organizations to craft these. We put together a comprehensive package, $36.5 million, 20 million of which was the grant program, the emergency public health emergency grant program that we worked on and that I helped to draft and put together, but also 5 million for direct cash assistance for families. 3.5 million of that will go through HHS, and 1.5 million is intended to go through the nonprofit providers and partners that we have. 1 million for existing HHS contracts to be able to meet what we know are exponentially increasing needs that organizations are facing. And so we know that the existing contracts are not going to be able to meet those needs alone. And so there's 1 million for that. 10 million to our hospitals to meet the surge capacity needs. We hope that that's an advance that the county is putting forward and that we're going to get funding back from federal and state sources, but we also recognize that we just could not wait to be able to meet the needs, because based on all of the public health experts, of which I am not, we know that these needs are coming fast and furiously, and every moment that we waste in not moving forward, waiting for money, is a moment that we could be costing lives of our residents. There's also $260,000 providing specifically to MANA to help MCPS meet the school meals needs for our neediest students and families. And that program has really surged in terms of the adoption of families, which is great news. We're expanding sites, but we can't keep up with those needs alone. And so that is what that 260,000 is for. And then lastly, 250,000 in a partnership with the Visitors Bureau, Visit MoCo. They will be launching a program and have launched a program as we speak to pay hotels a highly discounted rate, hotels that are struggling to stay in business. We've had dozens already closed down temporarily because they can't fill their rooms, but pay highly discounted rates from the county to provide places for healthcare workers to be able to stay, some of whom have vulnerable family members that they would risk their lives going home to, or who need to take a break in the middle of the day when that does not comport to children and other people who are in the household because they are on multiple 12-hour shifts and so forth. And so proud of that as well. Let me just quickly, I'll go through what the grant program does. I can answer a couple other questions as best as I can, try to cover some things that have been questions that have been proposed prior, and then I'll largely like to be able to answer any questions. It's a $20 million grant. First of all, we recognize that that is not going to be enough. We're limited in our capacity at the local level to be able to meet what we know are growing needs. The way that I have framed it is, I see us as the ambulance. I see the federal government as the hospital, but you have to get a patient to the hospital, and the federal money is not going to be available for 6 to 8 weeks, most likely, maybe even longer. And we have a lot of businesses that aren't going to last that long. And so, ambulances have limited tools. They're there for speed and to get there as quickly as possible. And that's really what this intention of this program is. It allows for up to $75,000 for businesses, nonprofit and for-profit, up to 100 full-time equivalent employees. And it is for operating losses directly tied to the public health emergency. And so just to clarify, the intention of this program is not increased service needs. It's treating nonprofits as the employers that they are. So nonprofits were intentionally included specifically because we see nonprofits as some of our most important employers in the county, but it is not treating nonprofits as service providing organizations. It is treating nonprofits like businesses because you all are businesses and you all are important employers. But I just wanted to clarify that because there is some misunderstanding about what would be eligible and what wouldn't. And as you think about what would be eligible and what wouldn't, you should think about the organizations as an employer and a business, not as a service provider. Because the other funding, the $6 million, 1 million of which directly to those existing contracts, the purpose of that funding is for service providing and to serve vulnerable populations, which is a different issue, a critical issue, but one that these grants were not set up to do in their current capacity. Sole proprietors are included. That was left out of the state program. It is part of the federal program. We think that that is a really important piece of this. There are some questions and have been some confusion about the types of nonprofit, whether a 501c6 or C5 or some other organizations would be eligible. We did not exclude them intentionally from the bill. The county executive still has to implement this program, but they, as the bill is written, would be included as a nonprofit or for-profit as an employer. I point out, though, for the 501c6s and other organizations, again, it's as an employer. And so in order to demonstrate significant operating losses as a direct result of a public health emergency, you have to have some type of fee for service or some type of revenue, earned revenue, that is lost. It's not intended to fill in for a lack of donations or an increase in service needs. It's intended to deal with the fact that as a result of the public health emergency, we have by design shut businesses down or dramatically slowed their ability to earn revenue. And we want to make sure that we are doing what we can to keep them afloat so that you're not being penalized for helping to solve the public health emergency that we are in. Another question was asked about religious-based or affiliated institutions. That is ultimately up to the county executive in the way that they set it up. However, based on the conversations that I have had, which have been constant throughout this process, we've worked very collaboratively with them and with county executives, senior staff that we, implementing this program. Like they see this, like I see this, as employers, and we are trying to not be discriminatory of what an employer is. So if you are a child care provider, for instance, and you have a staff and you are affiliated with a church or a mosque or a synagogue or some other type of religious institution, you would not be penalized for that. Or if you are a nonprofit organization that has some type of affiliation, loose or close affiliation to some type of faith, you would not be penalized for that as an employer. And so obviously we're not going to be funding for religious programs, but by virtue of the fact that you have an affiliation, it would not necessarily hold you up. The question was asked about fundraising activities and whether lost fundraising would be considered part of this. That was not intended to be part of the grant program and how the grant program would work. I obviously recognize, and all of us recognize, how much of an impact that has had on so many organizations, but we at the county level would just not be in a position to step up and fill in for all of the lost fundraising opportunities over the several months that this may go on. But for instance, if you have an organization that happens to be a nonprofit that charges for classes or charges for a show or charges for some type of service, even a healthcare service, that can't charge the $30 copay, then that would be considered part of this as well. The specific details on this obviously have to be determined by the executive branch. They are doing that as we speak. That work started before we passed this. We introduced it a week ago Tuesday.
Lesley, I think his is frozen now. Yeah.
There we go. I'm sorry. I thought it was me.
No, I think it's Andrew's is frozen.
Okay. All right then. And yes, he's just dropped off. Let's hope that he rejoins. Seriously, I was trying to figure out if it was me that was frozen.
No,
Councilmember Friedson, you're back. Can you unmute yourself? Or let me see if I unmute. There you go. Welcome back.
Okay. Apologize. Some reason I got kicked off there.
Yeah. happens.
So at any rate, the executive branch ultimately is going to be making the final implementation decisions. We're legislators. We write the bills and we appropriate the funds. That's what we have done. And ultimately they will have to do that, but we'll be continuing to work closely with them with the goal of getting this out as quickly as possible, which is a shared interest that all of us have. I think this has been a good example of how we can all put aside any differences to work together to try to solve the issues that we all recognize we face. And the one other piece that I would say is we all recognize that this is a first step. It's not going to solve every problem that we have. There are lots of aspects of this that we couldn't address. We're committed to continuing to take a look at what needs still exist, but we knew we needed to move as quickly as possible to help get this out the door and to help those who need help immediately. And so that's what this is intended to do. And we're going to continue to work with the executive branch to work that out. Couple other things on the additional funding from yesterday, and then I will open to questions. So I know there's a tight agenda. One is the $6 million for vulnerable populations. $5 million is for direct cash assistance to families in crisis, and $1 million is to the existing HHS. I will readily admit I was hoping for more money to go to nonprofits, but we have to come up with compromises, and that was an area the county executive felt very strongly about cash assistance for families. And so within the cash assistance, it is split to $3.5 million HHS will be giving out, and $1.5 million will be partnering with the nonprofits as a pass-through to give to folks that they that they work with, their clients. And there is a emergency assistant for residents task force to address the $1 million and how that funding will happen. Those meetings began even before we appropriated the funding. Last Friday, I think they met, and they're continuing to meet. That has representation of several nonprofit providers to work with the executive branch on that. And then additionally, the cash assistance, there's a task force that's been set up with executive branch staff and council staff, including Councilmember Albornoz has representation there, and the HHS committee, and they'll be working through exactly how the direct cash assistance will work through HHS and through the nonprofits, since that is still an outstanding question.
Great, thank you very much. I think your comments were very clarifying about the intent of the funds. And of course, we'll kick it off with a couple of questions. I will say, judging by the chat ahead of time, the biggest questions were, how can we apply and when will the money be available? Do you have any, of course, do you have any clarity on that right now?
Well, all I can say is that we're all committed to getting the money out as quickly as possible. There was some conversation of whether we should be on the front end or on the back end of federal and state money. I felt very strongly, like I said, that we were the ambulance, that we need to get this funding out as quickly as possible. That's the only advantage that we have. We have very limited pockets and tools and levers compared to the federal government, and I'm glad that we landed at that point. And that's where the agreement now currently is. I've set the standard that DC got this program done in a week and up and running in 7 days. We had a head start because we had the week between where we basically knew what this was going to look like and have already had those conversations. And so, I'm expecting it to be days, not weeks. The county executive has said his interest is to have this up by next week. And I'm hoping that it will be up, as soon as possible. And we're going to try as hard as we can to communicate. We'll make sure, Lesley, through you and others, that we are getting the word out to folks to be able to respond. Let me just say one of the things. There was a question about how will people know about this. There is a dedicated team, and part of the legislation requires designation of specific people in the executive branch to be able to reach hard-to-reach communities and business owners. So that is part of the focus of this. And then also part of the focus that we are working together on is making sure that there is a team, not just to access the $20 million in the county funding, which we recognize is very limited, but to help folks navigate through the various other programs that exist, including the federal programs, especially, and the state programs, which we hope they'll add money towards because they've already run out as we speak.
Councilmember Friedson, on that point, we've had some questions about whether people are going to be required to also apply for related state and federal funding if it's available. in order to get the county funding?
So no, the bill is written specifically to not require that. There was an interest to make the funding, quote unquote, secondary to federal and state. We worked really hard to make sure that wasn't in the final bill, because I felt very strongly that that would require you to wait until all of the federal funding and the state funding went out. The state funding isn't expected to go out for 21 days, and it's already run out. And the federal funding is probably 6 to 8 weeks based on what we're hearing, based on reports. And so that is not going to be the case. That said, we highly encourage everybody to be applying for as much funding as they can, recognizing the fact that, one, any dollar the county spends on one organization, it can't spend on another because we're limited. And number two, our pockets are just much smaller than the federal government. And so as much funding as we can get from the federal government is critical. And there is some good news from the federal package. We expect the state to get 1.25 billion. We expect the county to probably end up with about 175 million, based on the initial projections. And we already just on community development block grants, just under 3 million in emergency solutions, which will address some homelessness issues. That's about 1.439 million, which specifically we already know is on the way. For the rest of the 175 million, we're still figuring out what that looks like, but we feel like we'll be well positioned to receive a significant amount of federal funding for the needs that we have.
That's great news. And I'll have to say, having listened to several of the calls about the funds from the federal government that are coming, that nonprofits are eligible for, I think nonprofit leaders should feel much better today in light of the action of the county and the federal and state government than we felt last week, because we know that there's some great programs that are available, and Nonprofit Montgomery will be trying to get the word out about all of those programs. Councilmember Friedson, another question was, how far into the future should people project losses? Is it basically an April to June timeframe, or is it longer than that?
It's hard for me to say. I have been very adamant publicly and privately that this is a time in a public health crisis that politicians should listen to public health experts and not the other way around. And I think we've gotten it backwards, not just, not in the county necessarily, but certainly in the country. And hopefully we're just beginning to reverse that trend. But this is not a time for us to be leading. This is time for us to be following the lead of those who actually know what they're talking about. So that is for me to say. I don't know. What I can say is based on what I have heard from public health experts. In terms of your preparations, this is going to be more likely longer than it is shorter. And that if we are going to be serious about really flattening the curve and addressing the significant challenges that we are going to face, I would be expecting, longer rather than shorter in terms of your planning with your boards and with your, finances and trying to figure out how to get through this. I would be thinking more the long game than the short game, and more many months than a couple months.
Great. Councilmember Friedson, several nonprofits have asked for you to clarify the 100 employee restriction, and also does that mean 100 employees total? If they have 500 employees total but less than 100 in Montgomery County, are they eligible? And is there any relief for employees, nonprofit employers with more than 100 employees?
So Montgomery County has to be your principal place of business for any of the organizations. So if you have 500 employees but less than 100, you probably wouldn't qualify based on the way that the bill is written. The 100 is full-time equivalents, and so if you have people who do shifts or other areas, it's not 100 people who work for you. And so I just think that that's an important point. There are a number of nonprofits, particularly those who provide services, that have folks working for them, on a temporary basis, maybe even moonlighting if they, folks with expertise. And so it's full-time equivalent employees is the standard, not just people who work for you. And I'm sorry, what was the last piece? Is there relief for people who have more than 100?
Right.
A lot of our biggest service providers, particularly those who serve some of the most vulnerable in our community, have more than 100 people who work for them, more than 100 full-time equivalents. That is absolutely not lost on any of us. That is part of what the $1 million is intended for. And I think we all recognize, given the crisis that we're in, that those safety net services, we're going to need to do more. And we're hoping that the $1 million will get us to figuring out what the federal money looks like. And I am personally hopeful that some of that federal money would be available, particularly for those providing services to the most vulnerable that have been impacted disproportionately by the public health emergency.
Great. Great, thank you. And clarification, I heard you say that it wasn't, the funds were not intended to make up for a loss of fundraising revenue. However, many nonprofits raise a lot of their annual revenue from one major fundraiser. And so if you're in the situation where your one major fundraiser was supposed to take place April, May, June, July, and you can't have it, so then you have a big gap in your budget. Would that be considered for these particular funds?
The way that it's the bill is focused on operating losses, directly tied. It's largely similar language to what DC has done. I think some of that would be based on interpretation. I think that if you were to ask what the intention of the council, it would not be to cover fundraising losses, unfortunately. That is not to say that we all don't recognize that that is going to be a huge challenge, and we're going to have to figure out together how we address that. And I think we're all committed to working together to figure that out. But the immediate relief package for employers is focused on the employment side of it and the operating side of it, and not necessarily the fundraising side of it.
Okay, thanks for the clarification. I think this is a good moment to bring in Councilmember Albornoz. Welcome, and thank you for joining us this morning. Thank you so much, Councilmember Friedson, for your explanation. I think that really clarified a lot of points. And I know Councilmember Albornoz, you wanted to add a few things, so please.
Yeah, let me just, I just wanted to thank you and thank each and every one of you. Like I said, you know, we know this doesn't cover everything. It doesn't do everything. It can't help everyone. But we wanted to make sure that we did all that we could for now, and recognize that we're going to have to stay in close communication and in close touch and having conversations like these to make sure that we continue to address the needs in our community, particularly supporting those like you who are taking care, oftentimes the most vulnerable in our community, those who are often lost and left behind. And I am committed to that. Gabe, you know, who's about to speak, is totally committed to that and has been a real leader on these issues. And we will continue to work together to get through it. And just thank you for everything that all of you are doing, Lesley, that you are doing, but that everybody on this call is doing, because we would not be able to survive and get through this without you.
Thank you.
Thank you, Lesley. Can everybody hear me? Okay, great. First of all, I want to just acknowledge and thank my good friend Andrew Friedson for his leadership. We all bring unique skill sets to the table from the council, and his work at the state level in the comptroller's office has been invaluable to help us process and think through how best to leverage state and federal funds. And he's just been doing an absolutely outstanding job. And all of us have been incredibly impressed by it. Want to start on two lighter notes. The first is, I have 4 kids under the age of 12. And so if you hear screaming or something crazy in the background, please, nobody call Raymond at HHS. I promise you they are not being tortured. And then just a quick funny story, because we all need lighter moments right now. On Saturday, my 3-year-old was playing with dolls in her room, and I could kind of overhear her playing. And I said, Mika, what game are you playing with your dolls? And she said, conference call. And I said, well, what are your dolls' names? And she called one of them Zoomy. So, you know, I think we're all sort of feeling a little bit of that right now. So just very quickly to bring up a couple of points regarding the resources that we provided yesterday to enhance what Andrew was talking about, because we've gotten a lot of questions about some other issues, is the direct cash family assistance that we mentioned. So we know that there are thousands of county residents who are not going to be able to access the federal dollars that are being made available. Right now, just this morning, we're processing the information that it looks like you have to have filed a federal income tax form in either 2018 or 2019 to be able to access the $1,200. And as we know, there are many county residents who are clients of the people who are on this call that make such a small amount of money that they haven't filed taxes or had to for quite some time. And of course, we know that there are a number of clients who are undocumented who also have not filed tax returns in a way that will allow them to be able to access those funds. So that is something that we're going to be working on with our county's Department of Health and Human Services and other entities to figure out how to get information to these folks as possible and help as best we can make sure they're not leaving any money on the table that will help them, and then by extension the county. So I think that's important to note. And the other thing that we know that's a huge issue is, as an example, there are people that have informal rent agreements that are out there who are renting a couch or a basement, and so they're not able to access these funds, or they're not able to benefit from the freeze that we've put on having people throw out on the streets, and evicted. So those are communities that we're hoping to directly serve through this direct cash family assistance. As Councilmember Friedson mentioned, we are working on building the plane as we are flying it. And I saw that Caroline Sturgis is on this call, and she very ably led us through a conference call last Friday that was the beginning of a process by which to determine the criteria on who's eligible for this direct cash family assistance. The process that we're going to utilize to follow to work through nonprofits as the pass through to get this out to residents. And we're also aware, just as a sidebar, that more people are in the shadows than ever before because of this administration. Fewer people are accessing government services because of a mistrust of just government, period. And so we're going to have to work overtime through not just our nonprofit sector, but our faith-based organizations, and creatively with our multimedia outlets to get information out to people once we know who's eligible, and make sure they know how to apply for it and that it's as seamless as possible. So there will be more to come on how those $5 million are used. And as Councilmember Friedson mentioned, we work hard to make sure that we provided some additional funds for organizational capacity of nonprofits, because we know many of you on this call have had to blow through your budgets to meet the surge in demand that you're seeing among your clients. And what has been happening, understandably, is that a number of organizations are reaching out to us individually as council members and as district council members, and that's not the most efficient way for us to be able to provide resources. And so we wanted to give HHS the flexibility through their existing contracting process to acknowledge and provide them with a tool to provide additional information for nonprofits. And we had a call this morning with Vickie Buckland and our colleagues in HHS to talk specifically about this. And we did write into the bill a request that we get an update every 2 weeks as early as April 10th. And so we will be working diligently with HHS and their executive staff and their administrative staff, who are, I know all personally and are all friends of mine, and I know many of you on this call, and I just can't speak highly enough about their professionalism and their understanding and empathy of what's going on out there. And I know how hard they're going to work to make these funds available. The other thing I'll say about these funds is we know they're not enough. Before we've even disseminated the information on how to spend them, the money's basically going to have already been spent. And so we sort of view this as a phase one. We do want to look closely to see what the federal government is doing and what the state government is doing to make sure that we're leveraging those funds as much as possible. But we know that there likely will need to be some additional funds made available. And within reason, we got to be careful. But the good news is the county does have reserves that we're tapping into right now, specifically to address the emergencies as they arise. And the other thing I wanted to mention is, in addition to the $20 and $6 million that was appropriated yesterday The council also did appropriate funds to our 6 hospitals to prepare for surge preparedness. The testing issue remains a huge issue across the country, but especially here in our region. And we know there's great frustration that our frontline nonprofit organizations whose staff are directly in harm's way and continuing to do their work diligently, and that certainly includes our primary care providers and our clinics, still don't have access to the tests that they need. And so as more become available, we have been working to ensure that there's priority given to those frontline workers whose work is essential and that has to continue to work forward. And we're working with Dr. Stoddard and Dr. Gales on that. And then I'll mention 2 final things that are relevant to the folks on this call. I'll be candid. We were caught a little off guard in the county yesterday by the governor's announcement of the stay-in-place order. The local jurisdictions were not given a heads up. And so many of us were flooded with phone calls from nonprofit organizations concerned about their staff's ability to be able to get to work because they were worried they were going to be stopped by police, worried about their clients and having, people obviously whom are homeless, what would this mean for them? There were many questions posted, and the executive branch worked hard along with the council and the Department of Health and Human Services to put the toothpaste back in the bottle yesterday. And while we've been able to respond to many of those questions on the call that we had with HHS this morning, we discussed, because obviously not everybody has an ID for the organization that they work for. And so we have discussed making available, in addition to encouraging all nonprofits to provide some letter or some document that staff can refer to if they are stopped. And I will say on that, just very quickly, the governor made it sound a little bit more intense than it actually is going to be. We've been doing this organically, but we've been working with police to make sure that they are as reasonable and flexible as they can be. But just to make sure that people aren't concerned, in addition to whatever documentation you're providing for your own staff, the county through HHS is looking at devising our own letter that we can circle out, push out either through nonprofit Montgomery, but also through the nonprofits who have contracts. And so Lesley, we can talk offline to make that available for folks so that they have an additional resource they can refer to, so that volunteers and staff can continue to report to work unimpeded and to not have to worry about things like that. So those are some of the updates to enhance what Councilmember Friedson was saying, and some other points that have been brought up recently. And I'd be happy to answer any questions that people may have. Thank you.
Great, thank you so much. And I think we're going to just hold on questions for the moment so we can go through our agenda, but we will open it back up later. But I thank you so much for addressing that question about nonprofit staff and volunteers getting to work, because we've been hearing that quite a bit as well. So it's good to hear that you're on that and we can share out information. Also, we had posted in one of our e-news recently, and this is on our resource page, there is a way you can apply to be an essential organization with the state. I don't know how they get that word out about who's actually official, but there is an application and we made it available, so people might also want to look into that. Thank you so much, Councilmember Albornoz, for those clarifications. And now I'm going to turn the agenda to Debbie Riley. She is the president of Nonprofit Montgomery's Board of Directors in her day job. She is also the CEO of CASE. Welcome, Debbie.
Thanks, Lesley. So I have the honor and pleasure of introducing Dr. Raymond Crowel from HHS. So Raymond, maybe you could put your camera back on and unmute. We are excited about hearing your perspective this morning. I know that you've been, faced with so many challenges, but our constituency would very much like to have you address some of the overarching issues that you're seeing in child welfare, as well as with the aging population. So I'm going to turn it over to Dr. Crowel. And again, Nonprofit Montgomery really appreciates your leadership and the tremendous amount of work that you do to interface with the nonprofit community. So thank you.
Debbie, thank you very much, and thank you all for hosting this today for nonprofit Montgomery. Let me start by saying, first, thank you for all the folks that are on the call today, including the council members and my staff at HHS and all the members of nonprofit Montgomery who've tuned in today, for the work that you all have been doing the last few weeks and continue to do and will do in the future. It is an enormous amount of work, and we are at HHS I have never been more humbled or prouder for the partnerships that we have in Montgomery County that are going to make the difference in this, I think, over time. The other thing is just an observation that everything that we have done in the last few weeks, and I think everything that we're going to do in the coming months, is uncharted territory for the entire county, for HHS, for the council, for the executive branch, and for the providers. We are having to do things and come up with things that we've never had to do before, and solve problems that we've never had to solve before. But I think that the thing that we have going for us is our partnership and a demonstrated ability across this county to solve a problem and to tackle it and to not be afraid to solve it. And if we keep doing that, we're going to get through this. I think the one thing I wanted to add about, just to underscore from Councilmember Albornoz's comment, was about the stay in place order and the exemptions. We are working on a letter from HHS will have our letterhead on it that essential agencies that we are contracting with and working with can use for their staff, can provide to their staff to carry with them. I do think that at least in Montgomery County, the word from Chief Jones from the county police is that they are not going out looking for folks to stop. If they stop someone in the course of their normal routine process, they may ask. But other than that, I think we should be okay. I do want to encourage folks to keep whatever IDs they have with them. We've asked our HHS staff to keep their IDs with them at all times, especially when they're traveling to and from work. So this will be one of the ways that we keep ourselves going. I think the observation for me, I'm meeting with my staff and talking with providers on a regular basis. We are certainly concerned about the welfare of children, and our child welfare system, our child protective services system is available and open, as is HHS broadly. We are open for business. We have not shut down business. There are some things we are limiting exposure in some ways that I'll talk about in a little bit. But I think it's important to know that we are continuing to monitor protective services and do protective services work. Our staff are on duty and accepting calls and triaging calls and deciding when and if they need to go out to do home visits and to do on-site investigations, but are doing a lot of work over the phone and continue to do that work as necessary. Our Aging and Disabilities Unit is reaching out to the senior community. The nursing homes are particularly a concern for us, and the welfare of seniors across the county. So we're working to reach out to them, to the seniors that we have contact with directly, and to nursing homes to make sure that they have what they need. Our assisted living functions and operations are continuing as we speak. And we're working with the Food Council and with members of the community to make sure that nutritional needs are met for our senior community as well. So those are just the 5,000-foot flyby. The other piece that we're working on continuously is our homeless population. Is working with our homeless population. As you know, many folks are living in shelters and more than usual because of hypothermia season. We've expanded capacity. But our concern is that with that many people living together, it poses a potential risk for the staff and for the families. So we have opened, and will be opening, I think in a day or so, 2 new shelters to try to reduce the numbers of people that are living together. And we're setting up a capacity with motels and individual spaces for folks who may be showing signs or symptoms or at risk for potential exposure. So there's a lot going on across HHS. We are partnering with the Department of Corrections in making sure that folks who are coming in the door are safe and assessed and treated, and that folks who are coming out of the jails are connected with resources that they need to stay safe as well. I think that's a broad brush stroke. I said a moment ago that we are changing. Our offices are open for operation and will stay open. We are shifting some of what we have done, what we're doing, away from front office and lobby-based and walk-in services. So our Office of Eligibility Support Services, for example, are closing our lobbies and waiting areas for folks. We're doing all of our work either by telephone or online, and where necessary, people are able to drop off hard copies of documents that we will then copy and get back to them, or copy and make use of, so that we can continue eligibility processes. There is a number that folks can call in just for general questions around that, around emergency support services. I want to make sure I have it. It's 240-777-1003 during normal business hours, and we can answer questions about all the things that are available and how to access those. Anything that has been available in HHS will stay available for us. Our services to end and prevent homelessness are likewise closing down most of their office operations, but we are flexing the hours, and I think we will have that information posted online by tomorrow or Friday at the latest, so folks can check those to see what the hours are. Again, it's an effort to reduce the number of people that are congregating or coming in to seek services. It'll help to keep them safe, and it'll help to protect our staff as well. So that's the 5,000-foot view of HHS. I have to say I'm aware and increasingly aware of the amount of stress that staff and county residents are operating under. This is, the unknown is scary. This is a virus that operates in predictable patterns, and if we observe the social distance guidelines and the hand washing guidelines, and then it gives us an added measure of safety. Shutting down access to public facilities and recreational facilities helps us to keep us safe, and we have to continue to do that. We are, through our public information offices and with help from our council members, putting out information, and with your help, putting out information to help folks stay calm, but at the same time stay vigilant about the needs to take care of themselves and the health of their families. So I think that's my 10-minute overview of where we are, and I will stop and take any questions that people might have. I do want to say that one of the things that's in your questions list, and I'll respond to that now, is that there's a question about uninsured individuals having to pay for testing, and that are coming through the Montgomery Cares clinics, and that's something that I've asked my staff to work on a solution for. I think some of the funding that the Councilmember Albornoz has mentioned earlier may be available to use for that, but we will find a way to try to support, to solve some of that problem for us, for the county.
Great, thank you so much. And I'd like to invite Vickie Buckland to come back on. I know there were some other HHS questions. Vickie, are you still with us? There she is. Welcome.
I am. I figured it'd be less distracting. There are a lot of faces up on the screen right now. Yeah, there were a number of questions that people supplied ahead of time. Thank you for that. It definitely helps us keep track of where people's questions are and what information we might have put out there that didn't find its way in all the places that we need it to find its way. There were a number of questions about services. Dr. Crowel addressed that, but I do want to underscore that there seem to be a lot of fears out there or misperceptions about what's open and what's not. HHS is open. OESS is open. Mental health services are open. Those services are being provided in other kinds of ways, but those services are available, and we've tried to be good about making sure that those services are available both for people who might have internet access as well as those who might not have internet access. So for a lot of those services, they're still available over the phone, even if you can't get online. So that information, we sent a number of different links to Nonprofit Montgomery, and I saw that in the most recent newsletter. Thank you very much, Lesley, for that. But all that information is on the county website. What's open, what's got modified services, how do you access that information? I will please encourage people to continue to use that resource. It's a tremendous resource. There's a huge amount of information that's there. We had a number of other questions around homelessness in particular, asking about whether like the shelters were planning on remaining open. As Dr. Crowel said, there's, we're doing all of this planning in real time. And so, this is another area where that's true. At this point, we have said that the shelters will remain open through the end of April, but that is not a hard and fast deadline. And that will depend upon what happens to all of us, just like all the rest of us have that same answer kind of for everything else. This is, I can see that far into the future. What comes after that, I'm not sure. And so we will deal with that as it comes. At the very least, that's what we've set up to now. But don't read into that come May 1st, all of a sudden everything's closed down, because that's not necessarily what that means. So I will ask people to have, to check in about that and to not make assumptions that something's simply closing. So the other ones, I know still a lot of questions about the county contracts. What will the county, what will happen with those? What will happen with funding, carrying forward? There's a lot of that's case by case. We are doing some intensive data gathering with our contract monitors. I want to make sure we really know what the universe of requests is. That helps us both kind of plan out all of the technical parts of procurement, but also helps us plan out, are there some general broad policy statements that the county needs to be considering? And obviously for us, that means staying in very close communication with folks in the executive, in the county executive's office, with the Office of Procurement and the county attorney's office. And obviously there are a lot of questions that are coming to council. It's why I've appreciated the regular contact with council members like Councilmember Albornoz, to simply let us know, because we're trying to get that information in on a regular basis. And so their willingness to be in close communication with us, just pass along what they're hearing, is so enormously helpful. We actually have a regular meeting with a nonprofit advisory group that we've had for a long time. Nonprofit Montgomery hosts that for us. We actually have that tomorrow. And I know that there are a few questions that organizations have about some of the guidance that's come down around things like the letters and like leave status for people who potentially are sick. This is our opportunity to really have an intensive conversation with a group of nonprofits to help us craft some of that language and make sure we understand the ins and outs of that. So I just want to acknowledge, I know there are some of those questions that are out there, and I'm hoping that we'll be able to have guidance fairly soon, but I want to have a chance to really have that intensive conversation with that nonprofit advisory group before we do that. Dr. Raymond, I don't know if you've got anything else you want to address right now?
Yeah, thank you. I just wanted to underscore two things. One is that this is as you pointed out, a long run process, and the dates that are in place now don't necessarily mean that are scheduled for things to end, don't at all mean that that's where they're going to end without question. We have to look at this moment by moment. I think we are just now beginning to, we're at the front end of what Dr. Gales in public health and Dr. Stoddard are calling the surge in terms of numbers of cases and the amount of hospitalization and the amount of illness that's going to sweep over the county. So this is going to be with us for many more weeks to come, and we will be doing our best, and we will be working with council to try to make sure that we are supportive and working with partners to keep things afloat. The other thing is just, I've seen a couple of questions looking in the chat about the $5 million and the $1 million, and when and how that'll be accessible. We will be working with the council and with the executive branch to try to work on to get criteria in place and to get processes in place as fast as we can, especially around how we get funding out to cash in the hands of members of the community who are in need, but also for the $1 million that's identified as support for organizations. The council member said this is a drop in the bucket of what's needed. We realize that, but we will be working quickly to get what we can out the door and get that information to you so we can set up something very quickly.
Yeah, and there have been a couple of questions about what about organizations that don't work with HHS but might work with other county organizations. We obviously will be taking a broad view that we've already been in contact with departments like REC and DHCA, because they obviously have some pretty wide connections with the nonprofit community as well. A lot of the most immediate needs are with HHS, and obviously we have a very, very deep and broad partnership with the nonprofit sector, but I know that that's not exclusive to HHS, so I do want to provide some assurance. It's not, we're not taking an HHS only necessarily view of what that picture might look like.
Great, thank you for addressing that. I did see those questions in the Q&A as well. So, so the bottom line is it's not exclusive to nonprofits that have HHS contracts.
I am not going to assume that HHS has full knowledge of everything that's potentially out there. Let me put it that way.
Okay, perfect. Great, thank you very much. And thank you again to Dr. Crowel for making time to come on the call. We hope to see you again. And thank you so much, Vickie, for your constant calming presence and advice. We really appreciate it. So next up, let's hear from the county executive side. We have Carolyn Sturgis and BB Otero to talk about some of the implementation issues that have been referenced on the call. I know it's not all worked out yet, but if you could just chime in and tell us what you know, that would be great.
Great. Thank you, Lesley. Good afternoon to everyone here on the call. Thank you so much for being available and all the good work that you're doing. Thank you for providing me the opportunity to provide an update of what's going on the county executive side. So it has already been mentioned. I know I was supposed to speak on the status of the implementation of the grant as well as the emergency assistance to residents. As it has already been stated previously, we are working as quickly as we can to define the program, the criteria, as well as the process. Last Friday, we did have a meeting with several nonprofits to get some suggestions on how the program should look and operate. We are gathering all of that information and including it in the recommendation that we are developing. Our goal is to move as swiftly as possible. We are aiming to have a draft made available before the end of this week for the county executive as well as council to review. We want to ensure that the comments that we have heard from our external partners get incorporated into the program that we are developing. Our goal we've been looking at is being able to see assistance land in the hands of residents within 2 to 3 weeks. So we are working quickly. So I don't want to be repetitive, but I do want to make myself available for any additional questions that this group may have.
BB, did you want to chime in on anything?
Sure. Thank you very much, and thank you for having us. This is really, really helpful, and it's helpful to hear folks' comments and questions. I wanted to, I think, reiterate something that Councilmember Albornoz said, which is, again, we know that this isn't going to cover all of the needs by any means, and so he mentioned that the trying to get to those populations that may not be served by federal dollars and other dollars coming down the pike. So we, that has been our first sort of strategy, is to really dig deep and understand who those folks are. So we have carefully reviewed the IRS information that's come out as to who will and will not get checks. We know there are a lot of people who don't file because of their level of income. And those folks, I think, a parallel to this, we're really talking about how do we help people file that short form, because if you do file it according to the IRS, you'll get the dollars, and the dollars are available through 2020. And so for those folks that can file and file a short form, we certainly want to look at helping do that, maybe through some of our VITA programs and so on. So that, I think, is a really, and there are really small and large pockets of population that aren't going to access, including our undocumented folks and so on. But we want to really understand the IRS piece so that we're not leaving any money on the table. That does not mean that if that's going to take a long time, people may not get something from the county. But as everybody has said, this is a really long process. This is not going to be just a couple of months. So we want to make sure that we are being really conscious about trying to get to as many resources and bring those into the county as possible. So I think that has been a really critical piece. So once we have that, we'll share it also with the committee to make sure that the committee has a chance to chime in if we've forgotten any part of the population in terms of that. And then we do think that there are several mechanisms within the government right now and within our nonprofits to be able to reach some of those populations. And so we're going to certainly come up with that. The third thing I'd like to say is that we're really trying to think about various ways in which to get the dollars out. It's not a one size fits all for different populations, depending on who they're connected to and what their banking situation or non-banking situation and so on. So we want to also look at the range of what would be easiest for what population. So just so that you have a sense of the kinds of things that we're discussing as we put this criteria together. And there are some national entities that are looking at ways to distribute cash to, because we're not the only ones looking at this. The philanthropic community is looking at this. Other large organizations that may have some emergency pots are looking at this. So we want to make sure that we're also looking at best practice that as it's coming out, and that we're not insular about the way we think about this. So I think those are some of the guidelines that we have given ourselves as a committee to look at, if that helps.
Great, thank you. And I know you have consulted with local nonprofits already, and trust that that will continue as you move forward with the plan. And I expect we'll be back here next week with a little bit more information. Thank you. Thank you both for joining the call. Let's see, and I wanted to just mention, we are running a little ahead of schedule, so keep the questions coming in the Q&A function, and we'll probably have some time to come on the end and ask a few more questions. So do go ahead and submit questions. All right, then. I also wanted to mention one more thing. We've had a lot of discussions among some of the convening organizations about, excuse me, what's the best way to get information out about services and other things. And I know we're all trying to keep updated on what's going on. And we have been working with the Collaboration Council and the Volunteer Center on looking at Info Montgomery. And Info Montgomery is quickly building some easy to update pages so that if people go to Info Montgomery, they want to know where clinics are open or where food is being provided, that the providers can have a quick and easy way to update their services. And we all have one place to refer to find out what the current state of things is. So, so that's in development, and we will definitely talk about that next week. Also on our next week's call, we are going to hear from Susie Sinclair Smith from MCCH on homeless issues and how the homeless population is being addressed. And we're going to have an important update on domestic violence, which is something that all service providers need to be aware of as you serve people. In addition, we're going to give a rundown of some of the funding options for nonprofits and provide some more detailed information to you next week. And then finally on next week's call, we've asked Councilmember Nancy Navarro, and she's agreed to come on to talk about what lies ahead. And there was a resolution on budget restraint. And so she's going to shed some light on what that might mean for all of us as nonprofits. So that's the next week's call. Moving along, I wanted to turn the mic over to Lesley Graham and Barbara Elmrich from the Primary Care Coalition. I know there were a lot of questions about what's going on with healthcare and with specifically with those emergency health clinics and the health clinics that are under the Primary Care Coalition. So we would appreciate an update. Thank you.
Thanks, Lesley. First, I know we're in a moment of crisis with the pandemic, but also want to take a moment of gratitude for Montgomery County. Our government and our nonprofit sector have long had a public-private partnership to provide and ensure safety net of healthcare for those who are low income, uninsured, otherwise vulnerable. So Montgomery County is, really stands out in this country for having that, and that's due to this county. That's wonderful. The two largest safety net healthcare programs are Montgomery Cares, which is for uninsured adults, and Care for Kids, which is for uninsured children. Montgomery Cares and Care for Kids both have eligibility that can be determined by OESS, the Office of Enrollment Services and Support. Although Montgomery Cares clinics can also determine eligibility, presumptive eligibility on site at this time. For Care for Kids, just in terms of where these programs stand, eligibility for Care for Kids, DHHS has extended eligibility for any Care for Kids children that were to expire in the next 2 months, has been extended already to June 30th. So that helps a little bit with applications there and making sure that children have services continuing. Families that are new to Care for Kids and needing that service, they can obtain applications electronically or by mail through OESS or through Primary Care Coalition's Care for Kids staff. I believe on the chat box and on the information that will be sent out by Nonprofit Montgomery will be the number that Dr. Crowel gave for OESS. There's also an email address that can be given in order to get access to applications there. For Care for Kids, all Care for Kids children continue to be served by their primary care, assigned primary care location in person or via telehealth as appropriate, with the exception that there's a significant percentage of the Care for Kids children who are assigned to school-based health clinics, which obviously are not open at this time. Those children have been reassigned to and distributed between 2 other providers now, so they are getting care. Well visits that include scheduled vaccines for children under 2 years of age are continuing with screening to ensure that the family is healthy and able to come in. Well visits for children over 2 years of age may be getting rescheduled for future dates right at the moment. Dental services across the board are really only being scheduled for emergency right at the moment. That's for children and adults. Montgomery Cares, which is for low-income uninsured adults, you can use the Find a Clinic button on the upper right of the Primary Care Coalition's website. That's primarycarecoalition.org to locate a Safety Net Primary Care Coalition, Safety Net Primary Care Clinic in the area of the county that is of need to your particular participants in whatever program you serve. In addition to serving uninsured county residents eligible for the Montgomery Cares programs, the majority of these clinics also serve and accept those with Medicaid. Some accept Medicare, commercial insurance, and see self-pay as well. So these clinics can serve, are serving a broad array of individuals. In addition to primary care, PCC continues to coordinate specialty care and medicines for Care for Kids and Montgomery Cares patients. In times like this, we often find that it is most effective for things to funnel through one single point. And that's what we've been doing at Primary Care Coalition with the clinics that participate in Montgomery Cares and generally form the safety net of healthcare for this county. And our single point of contact is Barbara Eldridge, who's our Vice President of Quality and Clinical Services at Primary Care Coalition. So she has been the person coordinating between the clinics and DHHS. So I'm going to turn it over to Barbara now for additional details.
Thanks, Lesley. So I'm going to touch on a number of things on medical services, on specialty care, protective equipment, personal protective equipment, testing. Lesley, thank you for sharing the questions from the participants, and I've tried to respond to all of them in my comments, but please send those questions if I miss any of those. As Lesley mentioned, the Care for Kids program, all the providers except for school-based health centers are open. That is the case with Montgomery Cares as well. All of our clinics are continuing to serve our patients. They are increasingly shifting to telemedicine with telephone visits or televideo platforms, secure platforms to provide care whenever that is possible. Pharmacy services remain available in all of the clinics, so patients can get generic meds that they are accustomed to getting in the clinics. That is continuing in person. Behavioral health services are continuing, again, shifting as much as possible to telemedicine, but still being delivered. Patients must call ahead to their clinics for instructions, whether they're looking for a visit or for pharmacy pickup. This is primarily for infection control purposes, but also recognizing that this is an evolving situation and it is possible that clinics may have to change hours or some services may not always be available. So patients should always call ahead. Some of the clinics are accepting new patients who are not already Montgomery Cares participants. Some cannot, another reason to call ahead. Lesley mentioned dentists and dental clinics. They are open for emergency and urgent care only, and we'll talk a little bit about that as well. Again, call ahead before anybody reaches out, heads out to receive care. In terms of specialty care, we operate a program called Project Access, which is a specialty care network that our Montgomery Cares clinics refer through. Our referrals are still coming in from these clinics at the same rate that they were before this public health emergency. But of course, the specialty care services are very limited. Community specialists, if their offices are open at all, are shifting primarily to telemedicine, and many are seeing only urgent and emergency specialty needs. The governor has ordered that no elective or non-urgent surgeries or procedures be done, and that is the case for both medical and surgical surgery and procedures. Once specialty care reopens, once this emergency abates, we expect that this backlogged demand will lead to a couple of problems that we'll be working through. One is that because currently those specialists that are open are tending to schedule a month or two out, we know that once this reopens, there will be a backlog of demand and perhaps some long waits for specialty appointments. We also know that this will impact our budget as we try to move much higher volumes of specialty through the system, and we anticipate that this will spill over into fiscal year 2021. I'm going to switch over to PPE and supplies now. There were a number of questions about that. We are working on a number of fronts to purchase and distribute PPE supplies and equipment, and we are soliciting donations. Folks who are interested in donating, if you have large quantities, you can contact me and I'll coordinate that on behalf of the clinics. If you have smaller volumes to donate, please consider contacting a clinic near you and simply delivering those as you can arrange with the clinics. In addition to PPE, clinics are in need of liquid soap and hand sanitizer. We are working very closely with the Department of Health to use our Montgomery Cares budget to purchase these items, PPE and supplies that we normally don't provide. And we're also looking at equipment that is needed by residents in their homes to be able to participate in telemedicine visits. So for example, we reached out to the American Heart Association. They have already donated and we have already distributed 50 home blood pressure monitors to provide to patients whose blood pressure has not been well controlled so that they can continue to receive care and management through telemedicine. Both American Heart and PCC are looking for other sources of home blood pressure monitors for that. Along similar lines, we are looking for body weight scales so that patients with heart failure can be managed remotely, and certainly thermometers or home pulse oximeters so that providers can help to manage patients with respiratory problems at home. There was a question about homemade masks, and so I want to address that with this group as well. Homemade masks are not considered PPE. The CDC has indicated that they are not PPE, but in crisis situations where there are no alternatives, healthcare workers may be using them. They may be better suited for general public or people in group living situations, but we are not distributing them to our clinics at this point. We are desperately looking for N95s, which are needed for patients who have, for providers who are caring for patients who have respiratory symptoms, and for providers who are offering nebulizer treatments to asthmatic patients and folks with other respiratory issues that may or may not be related to COVID-19. In terms of the testing, Raymond spoke to this earlier, thank you. Regardless of income or insurance status, COVID-19 testing is very limited throughout our state and in our county. The current state guidance for testing is that for someone who is experiencing fever and respiratory symptoms, they contact their provider, their personal care provider, primary care provider, for an evaluation to rule out other sources of their symptoms. So this may include rapid strep or rapid flu testing if those tests are available. But this is very key to understand that at this point, the recommendations for testing are that patients who have suspicious symptoms be advised to self-quarantine at home without testing and to seek medical care if symptoms worsen. So it's important to get in touch with providers, but we need to really level expectations that because you have symptoms and contact your provider, that you will be getting COVID-19 testing. That is not likely to occur in most cases. Most of our safety net clinics are not currently doing testing in the clinics. And for the uninsured and homeless populations, as Raymond mentioned, the department is really working to try to set up some reliable systems and access to that testing as it meets criteria, but that is still a work in progress. Meanwhile, we ask that folks not be sent to the emergency department for these symptoms because we must not overwhelm our emergency departments, particularly as we are starting to enter a surge period in our county and in our state. And these folks will not be tested anyway. Now, of course, there are exceptions. So folks who need to go to the emergency room and likely need to be admitted are those with very severe symptoms, a lot of difficulty breathing. I was in contact with one hospital yesterday who said the only patients who are really being admitted are those who are requiring respirator, ICU, or intermediate care in the hospital. And one last point about testing. Our clinics are seeing folks come in who are low-wage workers that have no symptoms, but are being sent from their employers and are being told that they must be tested and must have a letter about their test results in order to return to work. Clinics are sending letters back with these patients, advising them and the employer that testing is not indicated and cannot be performed. So again, any messaging that we can get out to the employer community would be very helpful. Finally, in terms of other resources, I want to remind folks that patient information in many, many languages is available on the CDC website. I will share a link where folks can get this in Spanish, in Chinese, in Thai. Every language I tried, they had it. There's also general CDC information available in Spanish and a number of other languages, not just related to COVID-19. There are a number of services in the county that are trying to help provide transportation assistance. One that we have tried to work with and that you may be familiar with or want to be familiar with is that Lyft has opened a program called Lift Up. They are looking to support delivery of medical supplies and provide access to necessary medical transportation, especially for low-income individuals. And they are also looking to support delivery of meals for those in need, including homebound seniors and access to children who have been receiving free or subsidized lunch at school. This is in addition to all the other services that we know of and that the county is providing for distribution. And finally, before I end and open up to any questions, I want to thank and acknowledge the very strong support and collaboration that we have with Montgomery County DHHS. I am in daily contact with my primary contacts, Tara Clemens and Dr. Gales, and they continue to be readily available to us and demonstrate their strong and unwavering commitment to the safety net. And I am deeply appreciative, as are all of our clinics and providers. And then a well-deserved shout out to our clinic leadership and staff. They are delivering care to our most vulnerable populations while also sharing information and resources with one another. They are exercising extraordinary leadership in supporting and engaging their own staffs during this very stressful time. And I can tell you that I personally, and on behalf of all of the Montgomery Cares and Care for Kids providers, we are very proud of our county and our healthcare personnel throughout the county who have risen to this most extraordinary challenge. Thank you.
Oh, great. Thank you so much. Lesley, did you have anything else you wanted to add?
No, I did just want to say that things do change rapidly. And as we all know, evolving situation, as we all tend to say. And I know there are questions about PPE, about can people donate homemade masks, et cetera. Continue to check the local hospital websites. We can give updates in future weeks because the availability of PPE and the needs may change. For instance, I know that Suburban Hospital has posted on their website that they are accepting certain types of homemade sewn masks, but not for their clinical use, for other things. So these types of questions may get answered over time, and the needs may change over time. So you can keep checking back on various websites.
Lesley, did you see the question that came in about what if somebody does not have a primary care provider, who do you suggest they call?
So if they don't have a primary care provider and they would meet the criteria for being under 250% of poverty and a Montgomery Cares resident, they can go to the Find a Clinic button on the Primary Care Coalition website, primarycarecoalition.org. Find a Clinic is in the upper right-hand corner of our website, and they can find one of the clinics that serves this population that's geographically located, call that clinic, and see if they're taking new patients. If the individual has Medicaid, they can call or access the website for their Medicaid managed care organization, and they can determine who they have been assigned to as their primary care provider. And they can also do the same if they have commercial insurance, is contact their insurer and determine which primary care providers in their location are accepting new patients at this time.
Great. Thank you. Meredith, were there any other urgent questions? I know there's a lot of questions still.
There are a lot of questions. No, Gwen, I guess one of the questions that has been answered somewhat, but we have a lot of questions about language access. Barbara, I know you talked about the CDC site, but as much as possible, if anyone on this call can share with us any resources in other languages, we'll be sure to push those out to our members.
I saw some questions about donating masks from 3D printers. Yes, masks, face protection. Let me make sure that I'm reading this question correctly. If we're looking at, yes, shields, not masks by 3D printers, yes, that would be great. We just need a, physical barrier. They don't need to be sterile. They don't need to, they tend to be reusable. So yes, that would be awesome if people had masks or other kinds of face or eye protection available. In terms of the homemade masks, at this point, we are not collecting and distributing those within PCC for the healthcare providers. Actually, today as we speak, clinics are coming to PCC and we are distributing 3,000 surgical face masks. So I think we're okay for the time being on surgical face masks and really seeking sources of N95s in particular, and then other eye protection, gowns, that kind of PPE.
Great, thank you. All right, well, we're getting on to 1 o'clock. So I wanted to thank everybody who spoke on the call. A lot of really good information shared. Thank you to all who joined. We will do it again next week and we'll be getting next week's agenda out to you. And I have to say, having listened to all of that, I do feel that the coordinating organizations like the Primary Care Coalition and of course our county government, that we have a strong infrastructure in place to address the challenges that we have. And I do feel very grateful for that. So thank you everyone for joining today. Again, the call is recorded. You can watch it on our website and we will see you next week.